We are constantly dealing with people saying that you've opened school feeding center, you've opened PDS shop. We try and walk to the school feeding center and the police beats us up. And Delhi government can say nothing to police because hamare control me.
Well, what we are trying to do is to get, we have these things called the police panchayats. So we're working with the police, and about 7 police stations have asked women saying, we'll come and pick you up. You just cook some food for us because we have 12-hour shifts. And in many of the far out places, the police themselves have to sleep in the police station.
I
So
understand.
they're going nuts. They're saying we are so some of the senior people are saying we don't know how to deal with, the fatigue.
Absolutely.
Nobody understands why the army hasn't been called. And then somewhere I saw that, Kashmir deals with curfews, but the rest of India doesn't know how to deal with curfews. So what? But the situation I'm on these other calls with our SDI networks, and the plight of the smaller African countries is terrible. In Ethiopia, as of day before yesterday, because of this Lent and all, people are kissing the door of the church and going in. And nobody can stop them. And the same thing is happening in mosques. And even this Jagannath temple in Odisha had this big event, so it's you're looking at all this and saying, who has to say what?
We are live.
Okay, now I'm going off. Put my thingy down, yeah.
Okay, so we'll see you at 3:40.
Yeah.
Welcome, Rajesh bhai.
Hello. How is everybody?
Gautam, have you ever met Dr. Tandon?
Yes, I have.
Yes, Gautam. Hi, how are you? Professor Kundu also there. I can see him.
Well, his camera is a bit frozen.
Ah, okay. Maybe what I will also do is I'm going to stop my video. And you will handle the audio, no, Costa? You'll handle the mute audio kind of thing.
Yeah.
Because otherwise noise comes in with so many people.
Okay. Okay, we have about 60 attendees so far, and we might take 1 or 2 minutes and then we'll start.
Hello, just click the mute button on your right, bottom right of your screen.
Okay, let's start. Good afternoon, everyone. My name is Kaustubh Bandyopadhyay, and I'll be your host for today's webinar. I hope that all of you are doing well and keeping safe in this very unprecedented time. But it's a tremendous privilege and pleasure to welcome you on behalf of the Priya Group of Families institutions. Today, we are going to discuss the impact of COVID-19 lockdown on urban informals in India. Our focus will be more in India, and as you can see that we have invited some scholars, activists, professionals from various cities who are working with the urban informals for many, many years. So we will hear out them. And we also have some participants from other countries as well. So since the time we first thought about this conversation, a lot of things have changed. Unfortunately, many such changes are not in the desirable direction. When we started this conversation amongst our friends, colleagues, we knew that the lockdown will have a deeper negative impact on the informal economy in this country. But obviously, how far, how deep, we really didn't know. And we don't know as yet. Uh, we also knew that people, particularly the migrants, daily wage workers, laborers, living in the high density informal settlements would find it difficult to maintain the much desired social distancing. We also knew that many of these people were living under fear of uncertainty, of being infected, of hunger and starvation, and death. But what we did not or couldn't anticipate is that people in their desperation would take the risk of returning to their villages and small towns, often on foot, walking thousands of miles, including children and women. refusing to believe their own governments, albeit from their lived experiences. We also couldn't anticipate that these hungry and frightened people will be beaten and humiliated by the state authorities, as well as by some of the fellow citizens. We also didn't know that these people will be denied to enter their own villages in fear of contamination. In our invitation, you might have noticed that we have listed three main questions. Let me share those questions. Okay, let me read out, since I cannot share these at this moment. Um, so for the first question that we asked was, what are the added vulnerabilities of these urban informals during and after the COVID-19 lockdown? The second questions that we asked, what the central, state, and local governments can do to address these vulnerabilities of the urban informals. The third questions that we asked was, what support the civil society groups, philanthropic institutions, and international organizations can provide to mitigate the long-term effect of lockdown. So I don't think that these are the most brilliant questions, but this will help us to structure our discussion today. But our esteemed panelists can any additional questions, and we can deal with that. So today we have a terrific panel, and none of them actually need an introduction, but just for the benefit of all of us, let me introduce each one of them very briefly. So we have our first speaker, Professor Amitha Kundu. Professor Kundu is currently the Distinguished Fellow at Research and Information System for Developing Countries, RIS. Until January 2014, he was professor at the Jawaharlal Nehru University in New Delhi. He has served several national and international committees, and he is also in editorial board of Manpower Journal, Urban India, Journal of Educational Planning and Administration, Indian Journal of Labor Economics. He has about 35 books and 300 research articles published in India and abroad to his credit. We have our second panelist, Ms. Sheila Patel, who is the founder director of the Society for Promotion of Area Resource Center, or SPARC. SPARC is based in Mumbai. And Ms. Patel works very closely with the National Slum Dwellers Federation and Mahila Milan, two community-based groups working on the poor, with the poor in Indian cities. She is also founder and chairperson of Slum Dwellers International, a network of community-based organizations spanning across Africa, Asia, Latin America, and the Caribbean. In 2011, Ms. Patel received Padma Shri Award for her outstanding contribution to transformation of the lives of thousands of urban poor in India. We have our third speaker, Dr. Gautam Ban. Dr. Gautam is the senior lead academic and research at the Indian Institute of Human Settlements based in Bangalore. He teaches, researches, and writes on the politics of urban poverty and inequality, urban and planning theory, housing, and identity and social practice. At IIHS, he has taught under several programs, including the Urban Fellows Program, Urban Practitioners Program. He has been active in several urban social movements on sexuality as well as housing rights. I'm also delighted that the founder president of PRIA, Dr. Rajesh Tandon, is also with us. Dr. Tandon was appointed as the co-chair of the prestigious UNESCO Chair on Community-Based Research and Social Responsibility in Higher Education for 2 terms, First one from 2012 to 2016, and then 2016 to 2020. In 2018, Dr. Tandon was appointed as a member of the subject expert group on curricular reform and educational institution social responsibility under Unnat Bharat Abhijan. So the general plan today is that, first of all three panelists will talk to us, and then each of the panelists might take 10-12 minutes. And then we'll open for discussion, inviting questions and comments from the participants. And after the open discussion, I will invite Dr. Tandon to summarize the key takeaways from the discussion. Just a few words on how, as an attendee and participants, you can contribute to the discussion. One is, you must have noticed a Q&A button at the bottom. Please click that button and a dialog box will open. You are allowed to type in your questions, not only questions, but also comments. If these questions is targeted to a particular panelist, please mention it so that that particular panelist can respond to your specific question. Well, you can also vote for a question by clicking up the thumb up sign on the left side of a question. It's almost like, liking on your Facebook. So you can do that. And you can also raise your hand by clicking the hand symbol if you want to talk during the time allocated for question and answer. And we'll try our best to create an opportunity. So that's the kind of general rule of participation in this webinar. So we are almost set, and without taking any more time, let me invite Professor Amitha Kundu as the first speaker of this seminar today. Professor Kundu.
Thanks, Kaustubh, Rajesh Bhai, and the Priya family. We are having this webinar at an interesting time. There's a Chinese proverb, there's a curse, may you live in interesting times. It's a time when the distinction between precaution and panic is getting blurred, not only in the people's perception, but even in the administrative orders. One is not very sure exactly what lockdown means for people, because on the one hand, you say there is a Lakshman Rekha, you're not supposed to come out of your houses. And then you are told that you have to also take care of 9 persons meal in a day and take care of the neighborhood. In fact, the understanding of what actually lockdown means at the neighborhood level is not clear. Policemen come in and in fact beat up people if they are walking. At the same time, the medical advice comes from popular and social media that walking with or without a mask is not very dangerous. So one is not really sure how this lockdown is being really perceived at the grassroots level by the people and also those who are implementing it. Now, in this very disturbing time, let me begin with one silver lining. And that is noted, and it's also being mentioned, that the rate of dissemination, the infection in India is somewhat less than what we have seen in China or other European countries or the Middle Eastern countries. And this has been attributed to, some people say it's because of the virus is somewhat less potent here, or the climatic conditions. There are various explanations. But I think one factor that strikes me as extremely important, which creates social distancing even before it was announced, and that is fragmentation of our labor market. The unorganized sector, the schools that send their children to, the hospitals that they go to, the public places that they generally visit, although there is no restriction on their visiting other places, the places that they eat, the localities where they live are somewhat segmented. And I can tell you, if we know that this has come to many of the less developed countries through importation. I think person who is arriving from Europe or Middle East in India, there's a very small percentage who will take the metro, will take a taxi, whereas in European countries, I think 5% of them would just get down from the plane and take a metro. So the possibility of communication tends to be much higher in the European context. And I think perhaps India, this great disparity that we have between formal and the informal sector, fragmentation of the labor market, and much less of interaction has been responsible for the slow spreading in the initial stages. That's my understanding. But I just want to comment on this lockdown which has come up. There is an assumption that lockdown in the cities certainly would mean quarantining of people. That seems to be an absurd assumption, because it is possible for the upper class and the middle class to say, okay, we just don't step out of the house, but we assume that everything else in the system will function, which means some people will have to come out of their houses. And that is really worrying me, that the impact of lockdown is very, very different in the organized colonies and in the unorganized colonies. I can tell you that the middle class and the upper class can certainly create an environment which is less risky for themselves by closing themselves into their houses or in their smaller neighborhoods. But if you look at the statistics of the living conditions, the large cities, and I looked at the data for 4 or 5 states, Maharashtra, Delhi, NCT, West Bengal, Tamil Nadu, and Karnataka, you find that the lockdown certainly would mean for 30% of the people not increasing the social distance, but increasing social proximity. No, we have about 33% of the households in the urban areas. In Mumbai, it's much higher. In Kolkata, it's more or less similar. Something like 40% of the people either live in one room which has a kitchen and just one room with an average number of persons being 5. Now, if the moment you say lockdown, you're not supposed to be moving out, you are really increasing the density factor. And obviously, in the slums and the low-income areas, people will move out of their houses. But earlier, if there's no lockdown, the ladies will go out for work in the various service sectors, maybe low productive. The men also will go out. And then density and the level of interaction within the low-income household would be much less. But now with the lockdown, the level of interaction goes up because they have to really fend for themselves. You know, lockdown for the middle and the upper class, they can depend on their savings. Their earnings are also not being reduced, excepting perhaps 2 days of salary or maximum 1 month of salary. So you don't have to go out for earning your livelihood. But that's not the case in case of the informal settlements. I can tell you something like 33% of the households in Maharashtra and West Bengal in the urban areas are still dependent for their water supply and sanitation outside their premises, which really means that the lockdown would increase the level of interaction. I believe so far the virus has not reached to that extent in the low-income areas, but once it happens, and the lockdown will certainly exacerbate the impact, and the rate of infection would rise very significantly. I just want to mention one more point, and then I would come back if it is required. You see, as far as the interstate migrants are concerned, I did a quick calculation on the basis of the data, National Sample Survey 2007-8 and 2011 population census. About 68 million interstate migrants are there, including the family members, of course. And out of those 68 million, 22 million are workers. Now, workers would mean workers in different categories. I tried to find out the number of workers in the as casual workers who have daily or weekly arrangement for work. That comes to something like 7.5 million. And there are another 7 million people who are getting their salary on a monthly basis, but they are in the informal sector. And both these groups are going to be badly affected, despite the great, statements. I think it has come from the highest level. Some people certainly would pay perhaps for a month or a couple of months for the domestic help and the others, but nonetheless, for 3 months of guarantee is not there. People have not perceived. Now this, as I mentioned, about 15 million people who are interstate migrants. Plus you add the vendors, about NSS again shows, estimate based on that shows another 7 or 8 million. Half of them are interstate migrants. I would think about 16 to 17 million people are in a state other than their place of origin, place of birth, and 24% of these migrants are from Uttar Pradesh, 15% are from Bihar, 6 and 5% are from Madhya Pradesh and Rajasthan. Now they're in desperate need of going back. Had there been an announcement that, well, after 4 days, there will be a closure, many of them would have perhaps gone back. But still, my estimation is, I'm not very sure about that, that about 15% of them have somehow managed to go in a very, very difficult condition and reach. And the difficulties that they're facing is something that perhaps somebody else can talk about. But I personally believe that once they go back to their small towns and villages in Uttar Pradesh, Bihar, Madhya Pradesh, and Rajasthan, it's going to be very, very difficult to control that. So my submission, therefore, would be, as it has been done in the case of Kerala, Delhi has also done it. I think some other states are also doing it. I am perhaps not familiar. They have to see to it that the people are told that there will be no problem in your accommodation, your food, and for at least coming 2 months, there should be no problem in sustenance and also to some extent taking care of the families. Unless this happens, and if there's a massive exodus that takes place from the big cities in these 3 states, as I mentioned, Kerala, Maharashtra, Gujarat, of course it can include Delhi and Karnataka also. Bangalore is another city where people are going back, and there's a high incidence of the cases, positive cases. I think this would be very, very difficult. Finally, one quick comment I wanted to mention, just comparing the crisis during demonetization and the situation that exists now. During demonetization, there were problems for the unorganized sector. Severely it was affected, but still everybody cooperated with each other, every group cooperated. And because the objective was somehow to get out of this situation for some time until the notes become available. So they entered into informal contract based on the trust, based on relationship. Okay, the paid services will be delivered now, payment will be made later in cash or kind. But now, I think Sheila is in a better position to talk about it. I think the civil vigilante which has come up is certainly doing much damage to the unorganized sector. Anybody coming in the organized colonies from outside for domestic work is being stopped. And certainly everybody is now being a vigilante on the others. Anybody has a green sign in front of their doors saying that you are quarantined, everybody is jeering at them. Northeastern people are also being targeted. I have a feeling that the civil society activism needs to be formalized, institutionalized. I do not think the government's capability to deal with this situation alone is tremendous. There has to be involvement of the civil society, even in the rural areas. I'm chairing one NGO, Samarthan, and we have instructed the village local bodies to accept the people who are returning back, but not to keep them in one room, keep them separately to the extent possible. Those who have some kind of a symptom can be kept separately, but I think engagement of the civil society in a manner that this antagonism does not remain is extremely important. And I think that's how we should be in a position to approach this. And total lockdown continuing beyond this period is going to be very, very difficult and will create immense problems for the unorganized sector and interstate migrants. Thank you. I'll stop here.
Thank you, Professor Kundu, for these deep insights. And some of the numbers that you have mentioned are mind-boggling, that so many millions, like 16, 17 millions of migrants, and of which a majority of them are coming from Uttar Pradesh and Bihar, and they are going to be badly affected. They are already affected, and if you have cautioned that if it goes on beyond the 21 days of lockdown, it will have a very severe effect. The other point of this civil vigilantism is definitely a concern, and what we are witnessing, most probably a classic class struggle, and we need to keep that in mind. Let me invite our second speaker, Ms. Sheila Patel. Sheila ji, are you ready? I think she's in another conversation, but if I may, Sheila ji, are you ready? Okay. Let me then invite Gautam, Dr. Gautam Ban, as the second speaker, and when Ms. Patel is ready, then we'll hear from her. Gautam, all is yours.
Yes, sorry, I was muted by the host. Can you hear me now?
Yeah. Good. Sorry
Cool.
about that.
So thank you to Priya, Kaustav, to Rajesh. Good to see everyone here. So I'll be brief. So I want to say, take a little bit of a different track and basically talk about the way in which one can think a little bit about practices at this point that come from this diagnosis of inequality. So given our inequality, what are the ways in which that we can do? So I'll focus on 2-3 broad approaches that I think that we should be experimenting with at this time to think about how to deliver towards informal economy workers. Before that, I just want to lay one context that I think is important to think about this framing, which is to say, I think we have to remember that the aim of the lockdown against COVID-19 is to prevent death. Right? The data that we're all looking at is the number of deaths. And I think that the thing we have to understand is that when your ultimate goal is to prevent mortality, then you have to consider both the health-related mortalities that COVID will give you, but as well as the economic-related mortalities that a response to COVID is going to give you. And I think that it is very important for us to equivalently realize that for the set of workers that we are talking about, the proximity to mortality, the risk of death, is equivalent from an economic constraint as it is from a health constraint. And the trade-offs that migrants and everyone who walks hundreds of miles is basically telling you that they are looking at a proximity to mortality on 2 grounds. So we have to understand that terms of lockdown have to understand the trade-offs workers are facing to avoid mortality. I don't think any discussion that says that workers are not aware of the health risks of COVID is foolish and patronizing. I think the question is that they're looking at 2 very hard choices, which is that when they work on daily wage cycles, there are 3 responses they have to think. What will happen at 5 days without new income? What will happen at 2 weeks without new income? And what will happen at 30 days without new income? This is an important cycle that a lockdown plan has to think through. At 5 days, the most vulnerable workers will face hunger. But at 30 days, all workers will need rent. So there are different economic consequences that come for the most vulnerable workers. And we need to think about a lockdown strategy that enables workers to physically distance, not that requires them to physically distance and make choices that they cannot make. So the first thing is to reframe the lockdown as an economic and health lockdown and ask ourselves, what do we need to give to workers at 5 days, at 2 weeks, and at 30 days that will enable them to actually take the behavior that they want to take to protect themselves, not just that we want to impose on them. And I think that the core things we're thinking about here are income, food, and shelter. Those are the three things that one requires to survive even a crisis situation. And I think that when you think about income, food, and shelter, one of the sorts that we are coming through is states that had stronger social protection arguments, infrastructures before the epidemic started, are going to be able to use those social protection infrastructures to reach a lot of their workers. States that didn't will actually have to innovate and create new delivery mechanisms. And it's the delivery mechanisms I want to talk about. So one thing that I see is heartening in the current response at the state level, not the government of India level, is that many states are explicitly talking about the impact on workers at least. Different states are announcing, for example, UP is announcing 1,000 rupees for daily wage workers. Wage compensations have been announced in different states of the country. We've talked about a government of India order that orders a moratorium on evictions, that orders a rent waiver for a month of April. And I think that tension in these is, by definition, informal worlds are precisely places where instruments of policy and regulation find it difficult to reach, because the definition of a lot of these informal worlds are exactly those that are in tension with regulation. So we need to ask ourselves, what are the ways in which we can actually deliver 1,000 rupees to a daily wage worker? Who is a daily wage worker? Where do you find them? Do they have bank accounts? How much will a direct benefit transfer scheme work? And the problem is that we don't have answers to a lot of these questions, and that they vary deeply in city to city and by sector. So I want to outline 4 ways to think about how to actually deliver the benefits and protections on rent, on hunger, and on income support, the 3 categories I mentioned. How can they be delivered to different types of workers? And I want to suggest 4 approaches. The first is that I think we have to think a little bit about the distinction between whether we can do universal transfers or we work through the sectors of informal work. I think that there is a deep appeal to universal approaches, but I think that we know from our previous experience that universal approaches tend to have particular kinds of gaps in who doesn't access them, and informal employment status is one of the key determinants of that gap. I think it is much better for us to look at sector-based approaches. So for example, organizations of workers are sectorally specific for most informal economy workers. Construction workers organize in one way, domestic workers organize in a different way, waste pickers have their own federations, street vendors have their own federations. Mass membership groups of informal workers should be the government's ideal delivery partners, more, I think, than universal announcements and pronouncements through the system. Because I don't believe we have the penetration outside PDS, I don't believe we have the penetration at any scale of any other universal mechanism. We are not, for example, like other countries in the global south. South Africa has household level data and household level banking because it already has a universal grant system that covers pretty much all of the country. They can debate what amount of income compensation, hunger compensation should be given. We cannot have that debate. We have to not ask what entitlement should informal workers get. We equally have to ask who's going to deliver them, who's going to find these workers and get the entitlement so that they can actually survive the crisis precisely in a time of lockdown. So my first proposition is to work through the sectors and to work, as my second proposition, not just with state institutions, but with informal worker organizations. They exist at scale. They're not nearly at the scales we need them to be, but they are going to be your best bet in combination with government delivery. So I think the question we have to be asking is, if you have a construction workers welfare board with registered construction workers, what percentage of the universe of construction workers do you think that is? And what percentage of the construction workers not registered with the welfare board are members of unions or other associations of workers? Together, how much of the universe are you covering? Now, Delhi, for example, has 40,000 construction workers registered with the welfare board. They've already got the money in their bank from the government of Delhi. Now, 40,000 is no question a very small percentage of the actual transfer that's required. But I understand the government of Delhi's position. How do they find these workers and do this transfer if they're not registered with the board? This is why we need a multi-institutional strategy of identifying and tracking and delivering these entitlements. And we anyway struggle with these debates in non-pandemic times, that we particularly have to front this discussion in pandemic times. A second approach that I think is useful is to say, okay, we can't actually track the workers through worker organizations. So let's use spatial proxies. So here we get to that question of earlier, which is how much does the spatial informality of living in low-income neighborhoods like urban slums, like unauthorized colonies, like urban villages, peri-urban neighborhoods. How much do these overlap with also working informally? Now, the more that overlap exists, the more saying, let me be universal within a certain spatial kind of targeting. So I will take all slums in Delhi or Bombay, and I will say all residents of those slums should get income, hunger, and shelter support. And my assumption is that I'm covering a large number of precisely the casual workers that Professor Kundu mentioned, right? So Delhi has, for example, 6% of Delhi's labor force is casual work. Right? Now that 6% is about 2 million people, it's 20 lakh people. You also have a 17 lakh slum population by government standards. That overlap is not coincidental. So the second approach you take is to think about spatial proxies, where the government moves quickly and say, let me target my delivery and cover all these areas and hope that I'm catching all the workers. The third approach I think that's important to take is to think about small loop interventions. Let me say what I mean by this. What I mean by this is, take the example of the rent moratorium. It is easy for us to say that landlords should not evict their tenants and that landlords should give a rent waiver. But 2% of rent agreements in India are registered. 11% of rent in India has a written agreement of any kind. This is true of elite rental as well as informal rental. The moratorium on rent evictions is unenforceable by policy. It's untrackable and unenforceable. What is possible instead? And then the second point I want to make is, for low-income informal renters, the data tells us very clearly that the landlords are only slightly less poor than the renters themselves. These are not elite landlords with large properties. These are also landlords that need support and are likely informal workers. This is particularly true of rent within informal settlements. So when we're thinking about this question, a small loop solution is when we think about a localized solution where a cash transfer for rent can be made from a small local fund to a landlord in order to allow there not to be an eviction or rent-based displacement. You know, on the ground, many people who started walking in Delhi and found themselves at the Delhi-UP border, on the ground, many folks who were there said that people were saying one of our biggest push factors, there are many reasons behind that decision to walk, but one of a really strong pattern of them is pressure from landlords. And the idea that you can nikalo a 2-week lockdown, but no one believes that this is not going to be a story that plays out over the next 3 months. And to survive rent in the absence of income for 3 months is not possible. So small loop solutions try not to go to macro spatial scales, but actually take local economies, circular local economies, and move money within them in order to plug the holes. This can be easily done. One of the models that we use in Delhi, for example, right now, is that a lot of citizen associations identify a local ration supply store or a kirana store, which is given a Paytm pre-advance payment, and local families can walk in and against that advance payment draw some supply for ration. These are all small loop local economy solutions that I think have to come up with. The last point I think for large macroeconomic responses is I think that the government of India really needs to think about 2 questions. Some of the surplus and stimulus packages that they are going to announce are going to be ones that target formal enterprises, but they are going to impact informal workers, because those informal workers are going to be connected to the supply chains of those formal industries. For those workers, even a formal sector stimulus package will have tremendous effect. But for workers where in the informal service provider own account worker largely has a buyer that is also themselves an informal service provider. You think of a barber under a tree where the client and the barber are both likely informal workers. Formal sector stimulus packages are not going to reach these workers. And I think that's what's going to become a big challenge for macroeconomic stimulus design, which is to distinguish. We need macroeconomic data, and the national account statistics are partly helpful on this. But a large set of people, home-based workers that are doing, supply chain value adds eventually that go into a factory. When the factory gets a stimulus, it will work its way down the chain as long as the stimulus comes with certain constraints. But it's not going to happen for informal sector workers that supply to informal sector workers as consumers. And we need to know what that division is at the macro scale. So I'll stop there, because I think one of the things that I'm really think what I want to put out, and I can answer more questions, is I think that while we have the diagnosis very clearly that a lockdown cannot mean the same thing in an informal economy as a formal economy, and this has both spatial and economic dimensions, I do want to consistently say that we must begin to understand that economic risk and health risk both cause mortality. Because I think the language that I'm hearing all the time is that in this moment, one has to privilege the health risk during a health epidemic. That is a false framing of a dichotomy if the eventual outcome of our lockdown is to prevent death, which it must be. So we have to think about COVID in relationship to already existing mortality in India on other health conditions. Let's not forget that tuberculosis kills more people in India than COVID has killed globally. And, and to also think about that if we end up protecting the spread of COVID and see a large number of people be pushed into malnutrition and death due to economic lockdown, then we have to ask ourselves whether our ultimate goal of mortality prevention has been achieved and not just a COVID prevention. And I think these are important discussions to have. And I would urge all of us to equally grapple with questions of how to deliver and implement to the existing informal economy. Because without those experiments and innovations right now, even if we announce the excellent stimulus package with all the right entitlements, no informal workers will actually get it. Thank you.
Thank you, Gautam. I think very insightful and pragmatic, a couple of suggestions. You have pointed out the need to work with the mass-based organizations of the urban poor and the informal sector. You have also pointed out that a proxy mechanism would be to work with all the informal settlements with or without any informal organizations. But then also you talked about very interestingly the small loop intervention and some of the things that at the national level and perhaps also at the provincial or state government level, some macroeconomic interventions perhaps would in a way mitigate, reduce the kind of risk that we are looking at. Let me now invite Ms. Sheila Patel as the third speaker. Sheila ji.
Thank you, Kaustav. I was desperately trying to unmute my microphone when I realized that you had to do it for me. So anyway, it's always tough to speak after Amitabh and Gautam and their amazing hold of statistics. But it gives me a very interesting insight into how those processes produce or prevent local action. Because one of the things that this particular crisis has produced is that unlike curfews that we have dealt with in the last 35 years related to riots, related to crisis of flooding and other things, the difference this time is that even the permitted movement of organized communities who have better ways of managing distribution systems within processes, they are no longer able to go to other neighborhoods and help people. So organizations are restricted by the physical locality within which they work. And this brings to our attention very starkly about the need for local organizations, local associations with good quality data about themselves and the people who live in those neighborhoods to be able to draw in or demand solutions based on who they are and what their problems are. So talking about the issue of migrants, all of us who work in informal settlements know how many single people are living in sublet accommodation in informal areas, how many people are there in construction industry and other places. And yet, and we had a lot of people who appealed to all of us to say, can you help them? How will you help them? And it took the government, and if I can recall, it was the first letter that we saw from a chief minister was from Naveen Patnaik. Amitabh, you forgot Odisha in the states from where migration occurs. We realized that you require state infrastructure and state involvement to address the volume of people in such situations who absolutely have no trust and faith in what the state can do for them. So they are like way below even the slum dwellers or the Juggi residents, because they don't have ration cards, they don't have IDs, they don't have anything which is from the state, in the state where they are. And so I think this particular crisis has demonstrated the need to treat these, we have all been doing studies of migrant labor, what do you do to stop, what does Narega do to stop it and stuff like that. But we haven't understood the implications of the volume of migration that is occurring, and now we are finding that even families are migrating. So what is the implication of that? What we've also realized is that for the first time, our organization, at least with all of us, we're dealing with the networks of district level organizations working in rural areas, where many of the migrants, even within the state, are moving, because the kind of hostility that those people were facing also requires a response and a strategy of those who have to deal with them coming in. And I think that that requires a urban-rural networking capability amongst not only ourselves, but also government. And like Gautam said, the issue is not just of surviving COVID, but also of food. And here comes, and I like this concept of the time frames. What we found is that in neighborhoods that had organizations, had some systems, they immediately would come up with families that require assistance immediately, waiting for others to come later. But where people were not organized, there were like collection riots. So well-wishers who tried to collect grain and go around basically had their workers picked up, because they felt that they were creating law and order problems over there. The other thing which is interesting to also know is, we said, why did India have less? I think also compared to all the other countries which had a greater amount of cases, India's tourism is much less. And it's one case we should be grateful about, because compared to the number of people who in that period came into the country, ours was much less. And so I think that is there. But I think now we are now seeing cases in informal settlements. And now in Mumbai, for instance, there are, localities we have a map where localities have boundaries. So if you go outside the boundary to get anything, that's not done. One of the things I'd like Gautam and Amitabh to answer is, you spoke about these packages and the fact that informal workers would, of one kind, would benefit from the stimulus package to formal and others don't. I think this is a very important period to recognize the long-term inadequacies of recognition. For instance, everybody talked about soap and water. Everybody talked about hygiene in toilets. These are impossible in informal settlements. So I think that this is very important, especially when we're talking about using spatial ways of dealing with things, which is the only way to deal with densities and mixed households, is to actually create the basis of information gathering at the neighborhood level that allows these kind of things to happen at a regular level, of finding who doesn't have, when there's a crisis, there's a lot of money that is spent. It's all picked up from welfare and other budgets. In Maharashtra, all the MPs, MLAs and corporators are told that their that their funds can be used for this. There's no tracking. None of us are tracking who's doing what. And the role of elected representatives is also not being discussed. So it could be one thing that we could do. And of course, our real big challenge is that there is no handshake in most cases of what government is doing and what civil society can and should do. And the deep divide within the within cities is creating these problems. And so in all the hinterland of large cities, people growing vegetables, having small farms, all of them are just not allowed to come into the city. And there's a very big crisis right now of not only food not coming into the city, but the plight of those small farmers and small dairies and producers who have no way to come to the market. So this crisis is going beyond boundaries of cities, and therefore this constant debate of whether it's urban or rural has to go off in today's world where everything is interconnected. And I think it's important for us to develop together protocols of how all the different state and central ministries have to play a role. The shortages are not because there's nothing available, it's because there is no delivery system. There's no mechanism to do these things. So I think I would prefer to use whatever time there is for questions and to find strategies and to look at ways by which we develop these networks of localities that can share ideas, strategies, and be supportive to each other with the advocacy work that we do. Because I think this is, especially for the, while all the states are planning different ways to deliver stuff, we all need to have an agreement of how to do things. We're also looking at this idea that Gautam talked about, the small loop of people making registers in their neighborhood to identify which ration shop to go to, where are their bank accounts, who doesn't have bank accounts, how is the money going to come to them, who should they go and meet if they need it, and then develop a kind of cascading network and maybe radio announcements that will help people to understand. So I'll stop there.
Great. Thank you so much, Shilaji, as usual. So let's move to the next round of our discussion, where we hear questions and comments from the attendees. I can see at least 2 hands raised. Let me first allow wait a minute. Okay, let me allow Mr. Venkata. So you are permitted, Venkata, you can talk. So let me then summon Shubham. Shubham, you can talk.
Yes, sir. Hello. Am I audible, sir?
Yes, clearly.
Sir, thank you. First of all, thank you for organizing this webinar. My question is to Amitabh, sir. Sir, he pointed out that there are around 16 to 17 million migrant workers, right? So I was just saying that, don't you think this is an opportunity to look into this? Like we have 16 to 17 million migrant workers, interstate migrant workers. So this is an opportunity to create employment